take a deep breath, take the higher road. That's what they always say, as if they know the way. They won't take it from me. But don't ever doubt yourself, 'cause life ain't just a dream. You make your own, so kick and scream. The people will act with a never-ending force. You never had the chance, so what you waiting for? The day has come, my friend, 'cause this is war. It's time and this is war.
Hey everyone, and welcome to another edition of Q&A with the nurses. I am here today with Nurse Jody and Nurse Michelle, here to answer all of your burning questions and address your comments, just as we do every Tuesday here on Nurses Out Loud. So we do want to encourage our listeners, if you have questions, comments, or perhaps you want to share your own experiences with what you're seeing on the front lines of healthcare, you can now submit those to us by sending them directly to nurses@americaoutloud.com. We encourage you all to engage in the battle and find your voice in this fight. But until you're able to do that, we will continue to be that voice for you. Ladies, welcome on.
Yeah, good to be here.
Absolutely.
Yeah, same. Happy New Year.
Happy New Year. I mean, we're almost there. We're almost to 2024. Today's date's 123, so that's interesting.
Yeah, great. Yeah, I'm hoping this year is going to be one of the good ones.
Exactly. Actually, that's not today's date. I'm sorry. Oops. That's not today's date.
I was gonna say.
That's like a
But
big
you
no-no.
know what? We all deserve a break, so we are pre-recording our shows.
That's a big no-no. I totally forgot that. Malcolm, don't listen. Don't listen.
Yeah, and we're working on a holiday. Hello.
Yes, exactly. We get double time today.
And Jody is just getting over being sick, and now Kimberly's
I'm
turn.
sick. Yeah, we're all having our turn here. Yeah, I had a little bit of a head cold. It's now trying to settle down into my chest. So, but I'll do just fine. I'll be nebulizing and doing all of the things and pop a couple of those horse pills. What are those called again?
Ivermectin.
That's it. I think I'll be just fine. But yeah, so here we are getting ready to kick off 2024, and we are here answering some questions. So I guess we'll just jump right in. One of the first ones I've got here, we have an email from one of our listeners. This is from Amy. And Amy wanted to send us an email that she is concerned. She believes that the Moderna COVID shot has killed her father. He was a retired clinical pharmacist for the VA hospital, was a medic in the Army in the Korean War. He received 2 vaccines in early 2021, and then after that, he developed angina a few months after he received his second dose of the Moderna vaccine. He was taken to a cardiologist. They then diagnosed him with a right bundle branch block. Lord help me.
Bundle branch block.
Thank you. And a STEMI ST elevated myocardial infarction. And oh Lord, his health kept on deteriorating just month after month. He was starting to have falls, joint pain, cognitive issues, and then he sadly passed away just this last week, just before Christmas. So first and foremost, we want to extend our condolences, Amy, to your family at the loss of your father. But she is concerned that she believes that this Moderna vaccine could be a contributory factor in his death. So she was wanting to know if we had know of anybody who's doing independent autopsies. She has a hunch that the shot was, again, a contributory factor. He was 86 years old, and she understands that, at that age, he's lived a good and long life. But, he was otherwise very healthy, and she had expected that he would live probably well into his 90s. But wanted to know about some independent autopsies being done there in the Phoenix area. And I don't know off the top of my head of anybody, but I have reached out through my network So I look forward to being able to give you a more in-depth answer on a later episode, or we'll connect off air and try to provide you with that information. I don't know, Jody, if you know of anybody, since you're in the Phoenix area.
I don't. And I wanted to try to get that answer for her as well. I will reach out to my network and see if there is anybody that would be willing to do that.
Yeah.
Yeah, yeah.
But
I know I had somebody else reach out to me and had a conversation about her mom being in the hospital and dying last year, and she just cannot get it out of her head that she let her be intubated and all of these things. So I really caution people with, like progressively pursuing, especially if they're so tormented, you know what I'm saying? Because it's like, at the end of the day, we're up against a lot of misinformation and a lot of scared people, that don't want to share the truth. And at that point, it's like, what do? You're paying tens of thousands to attorneys and lawyers and trying to find out, I guess what purpose would that serve? It's like, in her email, Amy lists out, he got the vaccine, then he developed angina, then he got this, then he got that, right? And so it's like, we're kind of already knowing which way that the progression, like he probably had some heart damage in his heart, after the second shot, then it took on more and damage. And so I would just, have you pray on it.
Yeah. And for those that are out there that are not medical, to say that you have angina as a first presenting symptom means that you have chest pain. Yeah. And then they said that he developed right bundle branch block, which means he now has an electrical conduction problem in his heart that's making his heart beat in an irregular way. So he's having chest pain, then he's having an irregular beat. Some people can actually feel those irregular beats. I can. And then it evolves to myocarditis, which is inflammation of the muscle of the heart. So we're talking about a progressive step that certain age groups of people, having been a person that presented with angina in my 20s and in my 30s for different medical reasons, it can be very dismissed, especially in women. Women are very likely to have a heart attack and not get treated simply because they're women. If you're not 55 or older, they're not paying attention to angina. They think it's your heartburn or you have reflux or GERD or something like that, but you don't have something that's cardiac. I encourage everybody out there listening that if you have any of these kind of symptoms, you just go in and you say, listen, I've got cardiac symptoms and I want an EKG.
It's important.
I want an echo.
You've got to advocate. You have to advocate for yourself. It's really important to note that women present differently with cardiac symptoms, and a lot of times it's back pain that they come in with. And unfortunately, there are some medical professionals that, as you said, dismiss that and don't understand that women present very, very differently than men. So very important to familiarize yourself with how symptoms present in a woman and advocate for yourself. Demand that EKG every time.
Yeah, Dr. McCullough has a whole protocol that's called the myocarditis protocol. If you have these kind of symptoms, I could write down that list in the show notes or make sure it's provided for everybody, that he has a whole list of things that you should be asking for from your cardiologist. And you would think you would not have to ask for such things. Like you're the patient, the doctor, you're counting on the doctor to know what they need to do. But his is it follows the heart failure American Academy of Cardiology guidelines for heart failure. So everything that he has on there should be what your doctor is doing with you. But for some reason, they're not. So we can include that in the show notes if y'all want to.
Yeah, that sounds like a good idea. If you'll send me the link, we'll make sure that we include that in the show. Also, important to note, at the end of Amy's email, she did find out that the Moderna that he had, both of the lot numbers listed on his Moderna vaccine card were listed on that high mortality list. So that's important to note as well. They are, I think, what is it? Know your, or how bad is my batch?
Howbadismybatch.com. If you have had the vaccine, you should look up your vaccine card, go to how bad is your my batch, howbadismybatch.com, and put your batch number in and discover if it's in a what kind of problems are being identified with your particular batch.
Yeah, and we'll include a link to that in the show notes as well. But Amy, we are praying for you and your family. We're very sorry for your loss, and we will certainly be investigating and trying to find an answer for you. And we'll reach out via email. And if we're not able to answer that on air for you, we'll reach out to you via email and see what we can find out. But I think more and more people are looking for this kind of independent, outside of the system, providers, doctors, medical examiners, and different things. I know a lot of people are looking at the treatment that they've received, whether it had been during COVID or even the treatment that they receive currently in the hospitals, and how I actually just did an episode with one of the nurses that works with us at Remnant, and it was just like system failure after system failure that really puts patients at risk. And Michelle, you just went through this as well as a hospitalized patient, and how important it is that you really have to advocate for yourself. And that's why I keep on trying to impart on everyone, you really need to have an advocate in place. Absolutely.
Well, let me tell you something about what just happened with me as far as advocacy. I'm 12 weeks in and it's coming to the end of the year. So if you're a patient like Michelle was this year and you had a major surgery or accident happen to you, then you've probably met your medical deductible like I did. So having been a person in the past that had major medical over the years, I learned the hard way that if there was something that you knew was probably going to need to be done on you, like blood work that hadn't been done that year, that maybe was your annual blood work, or any kind of imaging that tends to be expensive, I try to make sure it gets done before the 31st, which would be, the very last day of the year, so that it's on the year that I've already met my deductible and the cost out of my pocket isn't going to be as high. So 3 weeks before the end of the year, I wanted to have some MRI imaging of my hip and my sacrum and my lower spine, because I was told that the 3 screws were coming out. So I left my messages with my orthopedic surgeon to do that. And 2 weeks later, it took me hounding them to find them. 2 weeks later, the day after Christmas, they call me and say, "Oh, Miss Michelle, you have to have an appointment to have imaging. You can't just order imaging." I'm like, duh. That's why I left a message 2 weeks ago for you to do this. Their policy requires that. I said, it's your job to know your policy. And when I left a message 2 weeks ago, I clearly said, I want this done before the end of the year. So because they waited till the day after Christmas, which was the 26th, I had to have an urgent care visit because there were no doctors having any hours the week after Christmas because they're all on holiday. So I have to incur the cost of an urgent care. I had been 6 weeks without any physical therapy because of another mishap that they had done. I had been hounding them to get me my physical therapy reestablished. When my in-home physical therapy had found out that I had flown to Arizona, they said, "Oh, if you can fly to Arizona, you don't need any in-home care." And so they just stopped. They stopped coming to my house. And I said, okay, well, I need a list of therapies in my community so that I can get outpatient therapy. Nobody would follow up with me with a list. So when I finally got a nurse, which it was a nurse at the orthopedic surgeon's office, her answer was, "Well, it's up to the patient to find their own therapy." I said, "Listen, let's just talk rational human beings for just a moment. The average hip patient is probably 70 to 80 years old. I happen to be 56 years old, and I am not taking meds. But if I am an older lady in a lot of pain, I'm taking meds, and you want me to find what my surgeon thinks is the best therapy in my community?" And she says, "Man, we know therapies all over the whole state of Georgia." I said, "But if I say to you, the community I'm talking to you in, that you live in and I live in, you would just say to me, these are the therapies in that area." And she left me abandoned. So when I got to my urgent care appointment, the nurse practitioner that I got to see said, I think he was a PA actually, said, well, yeah, I know too, right in your community. I can't believe they didn't give it to you. I said, let me just stop for a moment, beyond my care here. I'm a patient advocate. I'm telling you, you don't have a patient advocate in this building. Okay. I am a nurse who even knows what to ask for. And I have had 0 physical therapy for 6 weeks long. So please, for goodness sakes, recognize that you don't leave old ladies and broken people who've had emergency. I mean, if you're in an orthopedic care, you probably had an emergency, something bad happened to you, right? So here I am, the emergency person that just happens to be a patient advocate, fighting for myself during the Christmas holidays. I'm getting stressed out over it, right? Because I know that it's going to be my money. And they kept saying, well, ma'am, if we can't get the imaging in before the end of the year, you're just going to have it done after January. I said, well, let me tell you what, though. If I have to have imaging after January 1, whatever the cost is, my insurance doesn't carry. I'm telling you, you're going to pay for it. This office is paying for it because I have with it. And here's the thing. It's like a joke. It's like Michelle being some attempt at bullying on a playground. And the bully's actually 10 times bigger than me, right? I don't have a chance at getting that money back. If they image me after January 1, they can say whatever you want to, Nurse Michelle, but tough luck, kiddo. And that's really what the medical community has to offer in general, is a lot of apologies. So I was getting pretty discouraged with that, finally fought for myself and got the order. And they said, well, honestly, you're probably the best person to put the order in yourself. So here's the order in hand. Call the outside the hospital imaging place and you tell them you need to be seen before the 31st. So I took the horns and I called that place first thing when they opened the next morning. And the people said to me, send it via email. I did it. I sent them a PDF version of it. And they said, okay, it takes about 2 hours to process. And this is going to be a relevant point in a moment. 2 hours to process. Okay, so I call back 2 hours later. Is it processed? No, ma'am, it's not. So I did this every 2 hours all day long for 6 hours. At the end of the day, they said, oh, ma'am, sometimes it takes 10 days to get insurance approval. And I'm 3 days before the end of the year. And I said, well, that's just not okay. I'm literally doing the work for y'all. I'm helping you. Tell me what I can do. So the next day I'm depressed. I'm discouraged. I'm into another doctor's appointment now. And they say, we're going to refax that order over to the imaging place. I said, thank you for doing that. So I call the imaging place and say, now listen, this is the second attempt to get this order into y'all. Surely you have it in your possession. The answer was no, they didn't have it in their possession. I said, I need somebody who's competent, who can find it. Okay. And they find it for me. They don't find it. And she says to me, they never found it. She says, why don't you send it to me? I said, well, that's what I did yesterday and nobody had it. She says, send it to my personal email right now. And I got a little excited because she was like my personality, like she's taking it on. And she said, oh, there it is. It just popped in my inbox. I said, well, what do you know? Email actually, the whole world knows that if you send an email with an attachment, that literally within seconds, the world gets it. But the whole people the day before had to say to me, we don't have it, don't have it, don't have it, don't have it. And I'm like, it's got to be processed. She says, yeah, that's kind of absurd to say that an email has to be processed. It's just received or it's not. Yeah. And I'm like, thank you so much. Her name was Rosie. I said I was going to shout out for her because not only did Rosie do that and get it immediately, she called the insurance immediately and within 2 hours had an appointment for me for that day. And when I usually don't have the time to write a letter, I said, give me your manager's name. I am writing a note about you. And I wrote this long letter basically saying, here's all your staff. This is what happened with all of your staff. Nobody advocated for me. I gave them a sense of urgency. Nobody gave a crap that it was urgent for the patient except Rosie. And let me tell you what Rosie did. And I told them everything Rosie did that showed how easy it was to do the right thing for the patient and that she's a rare gem. She's worthy of a raise. She's worthy of recognition. Please do whatever you can to honor her. And I sent it on its way. And then the next day, came in for my imaging and got to meet her in person. And she had already gotten honored by the note that I had sent to the boss. and we had a great bonding experience. And we may even have her as a guest on the show, because I'm telling you, if you're out there as a patient with major issues in your health, you know that when people start dropping the ball to help you, it is actually a form of almost getting clinical depression, because you are powerless and you know you're powerless. And here I am speaking as a nurse who even knows what to fight for, how to fight, and I'm feisty anyways, so I'm going to fight. And I almost was just completely overthrown by the failing system. I just had to tell that story. It was just an unbelievable story.
It's the system is just so broken, and it's a system, right? And anytime you're dealing with a system like that, it's it's just unfortunate. There's always these processes, and like you said, it's they take something simple and they completely convolute everything. But Michelle, I think you had a couple of questions that you were going to cover.
Yeah, just even I didn't even recognize as a nurse myself when they said, we've got to wait for the email to process.
Yeah.
Like my sick brain that was suffering and struggling is saying, okay, it's got to process. But when Rosie comes along and says, ding, there it is, it just popped in my email. It's like, yeah, this isn't actually a very hard thing to receive an email. It's just absurd, really. So anyways, okay, so I've got a person who sent in an email that says, I have 10-week-old twins, full term. They woke up this morning with some sounds of congestion. I'm not able to really get anything out with their nose sucker, but I wanted to nebulize them. I have the food grade hydrogen peroxide and iodine as well as the right nebulizer. I've seen that you've used it to help with RSV symptoms. I don't have cause for alarm with the babies yet, but I would like to be proactive and nip their symptoms in the bud. I'm so proud of her. And she says, what I need to know is, what is the right dosage for 10-week-old babies? And she gave me their weights, which was around 9 or 10 pounds. So this is not an uncommon question that comes to us nurses. And, you know, people are just wanting to know about what to do about their little people. But when you're talking about babies, you know that we're either talking about bottle fed or breastfed little people. And when you're that tiny, you could literally nebulize them at the breast. But there's like a whole RSV protocol that I told people that if you just kind of practice this protocol with your sick babies when they have respiratory infections, for the most part, you're not going to have an issue. And it starts with waking up in the morning, giving them a hot washcloth, you know, across their nose and getting all the crusty boogers off their face, and then putting some saline up their nose and bulb syringing that out. She said the sucker. And and we actually call it in my house, sucking your brains out, because the way that we do the babies in our house, I've asked my daughter-in-law, who has my now 9-month-old granddaughter, if we could do a video of what it looks like to actually nebulize a baby this age, because most moms don't know that there's an easy way to do this, but it looks really scary. And that's you sitting on the floor with your legs spread and your baby's head up at your crotch and your arms, their baby's arms under your thighs. You're actually pinning the baby down and their legs are free. And you put a tissue across their chest and you're comforting them and soothing them. My kids get a look in their face like, what's up, mom? You know, when I do this, and I already have the saline beside me and a wet paper towel beside me. And I just put some saline up in their nose, close off the other nostril, squirt some saline in it, and then start sucking their brains out and squirting it on the paper towel on their chest. And then I do it on the other side. And yes, it looks like they're drowning when you put the saline in. And yes, their eyeballs bug out. And yes, they start crying, but you're the mama and you've got to push through it, because you're actually clearing their breathing way. Because they are, if they're young, they're what we call obligate nose breathers. They don't really breathe through their mouth. They breathe through their nose because they're sucking. So you clear out their nose first thing in the day, and you do it a couple of times throughout the day. And you always do it before you put them to bed. But you're going to nebulize, and you can nebulize them at the breast. You can actually have just simple saline, and you can fan it at the breast, or you can fan it in front of their face and just blow it right there while they're sucking at the breast, and just make it very gentle and beautiful. It feels like smoke all around your breast, and it's quite lovely, and you make no big deal about it. The baby just really loves it, and they come to know that as a normal thing. And if they're super congested, you could do the high salt, which is 3% salt, which is the green Neil Med box that we can put in the show notes. and they will get, you only do that 3 times a day, like morning, noon, and bedtime. But another way that you can help that congested little people is have inside of your room a nebulizer for the little baby, not a nebulizer, I'm sorry, a diffuser. And I'm not sure if everybody out there is already people who like to collect their essential oils, but there are 8 essential oils that the Frontline Critical Care Coalition of Doctors came up with, and they are lavender, thyme, peppermint, eucalyptus, sage, and cinnamon. And if you keep the baby's room closed during the day and you have that diffuser running in their room, the room is literally saturated with these antimicrobial, antibacterial, antiviral oils that smell amazing. And keep the door closed. And when you put them down at night, they're going to have that running all night long. And you can actually elevate the bed by putting a book or something under the top of the crib just slightly, and make sure you've already cleaned out their nose. Sometimes you want to go into a shower, close the bathroom door, and run some hot steam and let the baby just read a book to the baby, sing to the baby, do the bedtime routine in the shower. Not in the shower. We sit on the toilet and the room is filled with shower steam, in the smallest bathroom you have, so that it does it fast and you don't ruin all your wonderful hot water for your late night hot shower that you need after putting this baby to bed.
Right.
Yeah. And then put that steamed up baby and just make it so calm and soothing. Like we read our books in the bathroom during sickies. And then I sing to you before putting you down and your head is clear. I have nebulized you right before you got fed. And now I'm tucking you into a room that has all this wonderful atmosphere of all these oils. And very likely you're going to wake up with a baby doing better the next day. And you can ventilate the room a little bit in the morning and get any sickies out of the house, out of that room. But for the most part, that person who sent in that question gets that answer. I still say every baby should be put down with X-Clear, which is pronounced clear, but you can get it in the America Out Loud store. Put that nasal spray in their nose right before putting them to bed, because it actually has medical citations that prevent ear infections. So babies that have all this congestion can get really bad ear infections. It's a way to stop the ear infection.
Well, I'm just going to say, Michelle, I'm not feeling well. I've got a little bit of this head cold going in. Can you come and put me down? And I mean, that just sounded so fantastic. The whole thing.
I'll rock you to sleep.
I mean, yeah, I could probably use that. It'll make me feel a lot better. We'll go. You can rock me in the shower. I mean,
Rub my back.
Rub my back. Yeah, exactly. Give me
Do some percussion.
Well, actually, you do want to pat their back. That's actually part of the protocol, is to actually do the patting of the back before while you're rocking them to bed, so that you can loosen up that fluid.
That sounds fantastic. All right, I'll pay for your gas. You're not that far. It's so important. So one other thing I wanted to touch on, I actually saw this, and this would probably be a better topic for Nurse News Analysis, but since I have it pulled up, I'd like to just kind of go ahead and get your insight on this. I don't know if you guys follow Dr. Ben Marble. I'm sure you do.
Yes.
Dr. O, the infamous Dr. O. We love Dr. Marble. But he posted the other day, he had a thing that was posted originally on the group Died Suddenly. And it says that the Australian government puts out a chilling notice advising health officials to opportunistically administer vaccines to patients who are under sedation or anesthesia.
Wow.
Yeah. Have you seen this?
They're giving the vaccine to people that are conscious?
It's kind of what this was a like a bulletin that went out to health officials, encouraging them to opportunistically administer vaccines to patients who are under sedation or anesthesia. So Dr. Marble, Ben goes on to put here, was talking about his mother, who had a minor surgical procedure here in the USA back in 2021. And after she got home, she read her discharge paperwork. And on her paperwork, it said that she was given a COVID vaccine, and which she had already refused. While she was unconscious, they're saying that she got the COVID vaccine. So
Yeah,
she called.
Yeah, that's shocking.
I'm telling you, it's frightening. So she called her doctor's office the next day, and they claimed that it was a paperwork error. And they said that she did not actually get the shot. So they had let it slide for the time being, hoping that was true. But Since that time, she has continued to have declining health. She had, including a minor stroke. And then he talked about, so she's had some declining health after that.
Well, I tell you, after just being hospitalized up in the blue state of Maine, knowing I was going to go unconscious, I made sure on my medical records that as I was signing my consents, I wrote on the on the outside that under no circumstances at all am I to have administered any vaccines for any reason at all, ever, without litigation risk. And I signed my name under that statement and said that there will be zero interventions done with me without consent of 3 people. And Nurse Jody was one of those people that I made sure was part of that. And I said that all 3 of the people on that consent had to agree before any decisions would be made on me while I was unconscious.
Yeah.
Because
And a lot of times I will recommend to people, if they do find themselves in a position where they're having to be hospitalized and they're very clear, they can have all of the paperwork in their chart that they want, that they don't want a ventilator, that they don't want remdesivir, that they don't want vaccines. That can all be in place. But all it takes is one person to not see that piece of paper in your chart. So what I recommend for people is to have notes posted, big signs, big Sharpie, put it at the head of your bed.
Oh, yeah.
Put it and I also recommend putting it on the computer next to the scanner where they're going to scan a medication, something like that. I always make sure that that we encourage them to have that there, because again, pieces of paper in a chart can be very, very easily overlooked. But again, that's frightening. We're going to talk more about that here when we get back from the break. America Out Loud Talk Radio plays on the iHeartRadio network. You can also listen on our media player from any web browser anywhere in the world. We have the best in-class apps available on Apple, Android, or Alexa 24/7. Great talk radio. All of our shows go to podcast the following day. You can hear them on apps such as Spotify, Stitcher, Pandora, iHeart Podcast, and many more. Be sure to subscribe and rate the show on Apple Podcasts for me. Don't forget to check out our online store at americaoutloud.shop, where you can find all of the products that we represent on the network at a discounted rate, including ASEA Redox, which I can personally speak to seeing fantastic results with, including better sleep, increased energy, improved mood, and a decrease in my joint pain. Use promo code OUTLOUD to save 15% off your purchase. We'll catch you on the other side of this break. Stay with us.
It's time and this is war.
This is Jody O'Malley with Nurses Out Loud. Did you know our body is made up of trillions of cells, and inside each cell, redox signaling molecules are produced? These molecules hold a sacred place in chemistry because as we age, the vital communication of our immune system becomes less efficient. For the first time ever, ASEA brings you the power of these molecules in a convenient and potent form to provide your body with the essential support it needs to thrive. Ever since I toured their facility, I take 2 ounces in the morning and evening, and my vitality and energy has been restored at a time I needed it the most. Go to americaoutloud.shop and get your exclusive 15% discount by using the code OUTLOUD.
Cardiovascular disease is the leading cause of death and disability. Lifestyle changes are critical, but you can also support your heart with concentrated nutrients. Healthy Cell created Heart and Vascular Health to support cholesterol and blood pressure with CoQ10, vitamin K2, resveratrol, and soluble fiber. And Healthy Cell's not a pill, it's a patent-pending gel you swallow. Get heart healthy. Go to healthycell.com and use code OUTLOUD for 25% off your first order. Healthycell.com, code OUTLOUD for 25% off.
The buildup of spike proteins is dangerous to your health. Global Healing's Foreign Protein Cleanse detoxes your body, removing the spike proteins, allowing your body to repair from within. Formulated by Dr. Edward Group and by Dr. Brian Ardis, Foreign Protein Cleanse targets and detoxes spike proteins in the body. Go to americaoutloud.shop and get 15% off using the code OUTLOUD. Global Healing, giving you the power to take control of your health naturally.
We know you love the versatility and portability of the Genesis Fogger, but sometimes you just want to set it and forget it. Well, we heard you. Introducing the UX4 HOCl Atomizer. This stationary unit quietly protects you and is perfect for smaller spaces. With over 250,000 units sold in Japan, it's now available in the United States. Visit genesisfogger.com/outloud to see the UX4 in action and receive a 15% discount on either Fogger with promo code OUTLOUD. With Genesis, you're ready for anything.
Changing the world one person at a time. Here we take on the challenges of our generation so that we can preserve future generations. We know that if America fails, the world will fail. It is incumbent upon us to carry the torch for liberty. America Out Loud Talk Radio. It's a fight for the soul of humanity.
Welcome back to Nurses Out Loud on America Out Loud Talk Radio. I'm your host, Nurse Kimberly Overton. And wherever you're listening from today and whatever you're doing, we thank you for giving us the gift of your time. Be sure to make AmericaOutloud.news your daily stop for all the latest news and happenings. We all must do our part and share the stories, the articles, the podcasts, and videos so we can help secure America's future. If you're just joining us, I am here with my amazing sister nurses, Nurse Jody, Nurse Michelle, and we are answering all of your burning questions on this edition of Q&A with the nurses. So Jody, I think we're going to follow up on that question that Michelle was talking about with the baby and the nasal sanitation. When should somebody be concerned enough that they're going to bring that baby into the to the emergency room or to urgent care?
Well, yeah, good. Okay. Yeah. So, because we get these questions a lot. How do I know when to bring my child in? Right. And, if we just go by like simple things. Are they eating? Are they peeing? Are they having enough wet diapers, like their normal wet diapers, based on their age? Are they pooping? Are they sleeping? Right? If they're doing all of those things, and maybe, they're not sleeping peacefully, maybe you're hearing them a little bit. But all of those things are really indicative of a baby that's doing pretty well. Right? And especially when you have someone else in the household, another sibling that's sick, you can almost guarantee that this baby also has that sickness, right? The cold, the flu, whatever the case may be. The three of us do advocate a lot for having a pulse oximeter in your home. Yes. So if you're looking at this child and you put a pulse oximeter on them and they're oxygenating properly, and they're peeing and they're pooping and they're having their diapers and they're sleeping,
but not too much. But not too much. That listless body, that weak kind of child, that's that sleeping too much moment, right?
Well, I mean, when you're sick, right? Mm-hmm. And definitely it's dependent upon age as well, right? Mm-hmm. But if a child, especially if there is another sibling in the household that is sick, chances are you're going to bring the child into the emergency room and you're going to get either a doctor that does every single protocol, or you're going to get a doctor that is competent on their assessment skills and will send you home telling you to, no, doctors don't really say nebulize, but we do, but to clean out their airway, right? With I think nose Frida is what my daughter had, and that little thing was just so good. I could not believe how good it was. But that's
makes
essentially
me sick. It makes me sick Why use a nose Frida when you could actually use a bulb syringe? And why would you want to suck from a straw? It makes me gag to think about it.
The nose, Frida, because you see it coming in the tubing.
Oh,
You
no.
don't just hear it. I just
Well,
love it.
oh gosh. Oh,
And it's a lot more powerful.
wait,
right?
wait. Okay. So I see what you're saying, Jody, because that's kind of satisfying, right? To see, I get that. But are you telling me that the mom sucks it like a straw?
Yes.
Yes, like at the other end, and it's a very long cord and everything. So it's not
Ew.
like
No.
I'm so nauseous type that even when I see it for sale hanging and I'm getting shower stuff for people for a baby, I'm like, I'm never buying a nose Frida for anybody. I'm getting them a bulb syringe.
Interesting. I do want to just really quickly comment, Jody, back up a little bit, piggyback on what you were saying about, and I agree with that, having that pulse oximeter for the baby. But it's important to remember, if it's a small baby or a small infant, that you can't use don't use the adult pulse oximeter. They do have one for babies. It's a little sock. I think it's called an owl. Is it owlet or owlet? I believe pulse oximeter, where they have a little sock that you can put on. And so, particularly if you have babies that might, a premature baby or somebody that has respiratory issues, that you want to be monitoring that. Very important to not use the adult pulse oximeter on the child.
Yeah, but I mean, having the pulse oximeter, I mean, it really definitely, really lowers your stress level, because if you look at that and you're saying that, that you have, that they're oxygenating properly, then they're good, right? Like why are you bringing them in? Because you're going to have the doctor. Like I said, you can have two different ways of thought, right? If they're under 60, some even 90 days old, and they have a fever and they can't they need to determine the source of the infection, this is what we do. We will cath them, right? Do a urinary catheter in their urethra. We will take blood cultures, so they got to get an IV. They are going to get a chest x-ray, and they could even get a spinal tap. Okay. Mm-hmm. This is what they do to go down and determine what the source of infection is. So it's extremely, what's the word I'm looking for?
Invasive, very invasive.
Extremely invasive. Now I've worked with doctors that say, oh, the sibling's sick. Oh, okay. Well, they got what the sibling has.
Exactly.
And then they'll let them go home. So if you have the pulse oximeter at home and you're like, oh, my baby, the saturations are above, I mean, for a baby, you'd want it to be, after doing the bulb syringe in their nose, because they're nose breathers, right? You have to make sure that their airway is cleared out there. But if it's above 94, 95%, I mean, you're good, right? And so it's fluids at that point, loving, rest, the whole bath, protocol.
Right.
And this is why another reason that I've always advocated for having access to a triage nurse, a telephone triage nurse. I actually did that for a while. My favorite callers were always the new parents, the new moms, because it's a really good opportunity to be able to educate them. And here's the thing: we want to keep these babies out of the hospital if at all possible. You just heard what Jody talked about. If you're listening, you probably, if you follow me at all on my Substack, you're probably familiar with the case that we just advocated for with Autumn Shaw, who was a victim of medical kidnapping out in Palo Alto, California. And it was one medical intervention after the next that really worsened this baby's condition to the point where, I mean, they nearly killed this baby. It was absolutely absurd. So I think that on the front end, we need to keep them out of the hospital as much as possible. Now, I would like to be able to tell you, call these free nurse lines in your community. I worked for one of those free nurse lines, and that's the nurse line that I ended up resigning from my position for, because we had a scripted answer about the vaccine to tell people that it was safe and effective, period. So I have a hard time even encouraging people to call that particular, community nurse line. However, not to shamelessly plug remnant nursing again, but we do provide that service. And it's so important. We are able to, you have access to a nurse so that when you are wondering, should I take my baby to the hospital? Should I take them to the ER? Should I take them in for to see their pediatrician? You can ask these questions to the nurse. They can triage the situation and they can give you some good advice so that you don't take the baby unnecessarily to the ER. So that's a very important thing to have in place as well.
There's somebody that I follow on Instagram. His name is Sean J. DeGreat, D-A Great. And he is so entertaining. I get a kick out of him. But his 4-year-old son just recently had to be brought into the ER for flu. And what he came on to tell was a shocking question that the nurses were being required to ask every single parent of a child that came into the ER. And she said, I'm really ashamed that I even have to ask you this question, but I have to ask you this question. And she said, is the gender of your child the same gender it was when he was born?
Oh my gosh.
And the child was 4 years old. And she says, I'm really sorry I have to ask that, but I have to have your answer for documentation. I mean, it just blew my mind. And he's like, you got to be kidding me. I'm literally here for the flu. My kid can barely breathe. I need medical intervention. And you're worried about if the child even cares what its gender is right now. Just unbelievable.
Mm-hmm. Yeah. And you can really see the level of indoctrination that's happened. And the more you can stay away from these hospitals and the mainstream medical, the better. I mean, I cannot stress that enough. Hospitals aren't safe places any longer. And they haven't been for quite some time.
Yeah, Jody gets to know, you're active right now. You're able to witness what is really going down. So we're glad that we got somebody.
Oh, exactly. Because, and I always say, when nurses are ready to get out, but the fact of the matter is that we do still need good nurses on the inside, because there are going to always be people that have to go into the hospital and they need somebody there advocating for them as well. So it's really important that we have good, critically thinking nurses still in the system to some degree.
Yeah, I mean, I feel just so blessed to be back, and I'm able to pick up whatever shifts I want. I'm not permanent. I want to stay out of like politics, so I just pick my shifts, show up, and work them. But here's another thing I'd like to piggyback off of the sick child, whether it's a baby or a child, is fever. Fevers are good.
Yeah.
Fevers mean the body is fighting. And so often people want to stop that cascade.
Yeah.
And, we're medicating them with Tylenol, which actually, is a depleter of glutathione. And glutathione is made in the liver and it helps with immunity. And so, I know when I had my child, when I had Benjamin, 15 years from when I had my last one, the doctor, my pediatrician, said, don't medicate him unless it's 104. And I was like, really? And now, getting out of this allopathic system and getting more into functional medicine, that number seems to be right on point. The only reason why we should medicate, like Michelle was saying, is if the child is listless, if it looks like they're in pain, if they're not able, to move or something, then yes, then it would be appropriate. But other than that, let the fever ride. And
yeah, I encourage the people to even put that warm tepid bath together and put a cup of Epsom salt in it and put the baby in it, and just making it a couple of actions, doing that a couple of times a day on their sickest day when they're alert, go ahead and do that. That can count as a steaming time, that they get a little bit of steam in the room before you put them in the tepid bath, that room full of steam, and then give them that tepid bath. It can help lower the temperature. But what are some other things that y'all would do besides IV fluids in the ER for that child that is coming in with a 104?
Well, typically we wouldn't be giving IV fluids. They would medicate. A lot of it is, are they eating? Let's say the one child that we had that was 60 days old. We went in there. The doctor did order to get a cath on him. And the mom and dad said, no, can you just put the plastic, which is not as sterile, right, over the penis to just try to catch it over the diaper. And then, we're waiting for him to eat. And she said they had brought him in because he vomited one time. Well, what do? We will do what we call a PO challenge. We will give some Zofran, right? And with this child, the doctor did order it IV, but after 2 attempts of trying to get the IV and get this child to sit still to draw the blood, the mom said, well, can you take a break? Well, then at that point, I just went to the doctor and said, hey, we missed. The parents want to wait. Can we just give them, under the tongue Zofran? And he said, yeah, give him under the tongue Zofran and then PO challenge him. So what wound up happening was we didn't medicate for the fever because the parents didn't want to, but why they came into the ER was because he vomited and that scared them. And so their daughter was at home sick with the flu. So we already knew that that was in the household and the baby probably caught it. And we wound up not having to do anything to him. We didn't even wait for the urine sample.
What does will you tell everybody what the PO challenge looks like?
Oh, so a PO challenge is, thank you, Michelle. I hate speaking above people. But yeah, PO challenge is you take the Zofran, the anti-nausea, and then you see if you can hold fluids down. If you can hold fluids down, then you're good to go and we'll send you home for the most part. Right. Yeah. And that's why like the TWC, they do have that emergency medical kit and it's important. There's so many things that we could do to not go into the hospital, like having the Zofran in the emergency kit. I think everybody needs to start looking at this as something they really do need to have prepared for. They have 8 different emergency meds that are given in emergency, right? If you're like, oh, I don't want to take big pharma and I want to try natural. Yeah, try natural. Try all of those things. But if they don't work, your only other option is to go to the hospital and get it or go to a doctor and get it. So if you can be stocked up and prepared for these things, like having the oxygen at home, if your oxygen levels are low, well, throw 2 liters on, hydrate yourself, have chicken soup, make the Jewish penicillin matzo ball, right? Like do all the things. But if you're vomiting and you can't stop it and you're not able, and now you're going to now you're at risk for dehydration, well, a little pill of Zofran will stop that. We don't really encourage people to stop diarrhea unless it becomes really bad because you lose your electrolytes in your poop, right? Potassium, magnesium, sodium, that like those things run your heart. So you have to be careful with that. But if you can hydrate yourself and not vomit it, or use oxygen to keep your sats up, that really eliminates a lot of reasons why one would go to the hospital or be admitted.
That reminds me of Shelley, who one of y'all have interviewed already for your show, who has her IV hydration clinic set up in a state somewhere. I think everybody does need to find out where their local IV hydration options are in their cities.
Yep. And we'll drop a link to Shelley. We'll drop a link to Shelley in there. That's a good point.
What state is she in? I can't remember.
She's
here in Arizona. She's up in Cottonwood.
Yeah, she's up in Cottonwood, and she's training nurses with Remnant Nursing, right, Kimberly?
Yep, she absolutely is. She's training our nurses are going through that course, so they're able to do mobile IV. That's another service that we're able to offer is mobile IV therapy. So we can go in the home, in the office, wherever you're needing that hydration, we can come right to you. So yeah, Shelly's amazing. I'm gonna have to get her back on the show as well.
Well, I've got a couple of things that people have been asking about. The people are still being harassed for masks out there. I'm surprised that it's happening. I mean, everywhere I go in public, I literally have cards for Immune Mist that tell them, if you have a mask on and you walk past Nurse Michelle and I'm not in a problem situation that I cannot do myself, I literally walk up and say, hey, I see you're wearing a mask. Do you know there's a better way? Has your doctor not told you about iodine nasal spray and throat spray? Here's a card. Listen, you can get this in your home. And I give them a whole little spiel, and they're always grateful because somebody's made them afraid. But if you don't know this out there, we have a link that we can put in the show notes to 170 mask studies showing harms and ineffectiveness of the masks. And what I'm surprised at is some of the medical people get a little snarky sometimes. They're like, we wear masks in the hospital. I'm like, yeah, right. I know why we do wear them. You know why you don them as well. And it's literally what happened to me in the hospital when the nurses said, it's my job to protect them when they come in my room. They were saying that through their N95 masks. And I said, do you not think your mask work? Is that why I need to protect you? And do you think your vaccine did not work? It's just it's like, even as they get asked that question, their eyes are like, yeah, that's kind of a logical question, isn't it?
I mean, these ear loop masks, they do not prevent aerosolized viruses, period. They do not prevent transmission. I mean, it says it right on the box. It says it literally right on the box. These do not prevent transmission. And like you said, they're vaccinated. They're like quadrupled, I mean, like 7 times vaccinated, and they're wearing masks, double masks, and they are still afraid of what they're going to catch. I can't understand it.
Yeah. Here we go again. It's all over again. And people's employers are still doing that for them. Yeah. We do have help for you to combat that. And there are links that we have already done from last year that show you how to confront any attempt at trying to mandate you for something. And if it's masks, then you can reach out to us and we'll try and do what we can to direct you toward those links where you can find information about how you can fight for yourself, because you have got to learn to fight for yourself and stand up against this.
Absolutely. Well, We'll make sure that we include all of those links in the show notes. I think that's it. I think we're running out of time. We're coming up against it. But thank you, ladies, for joining me for another edition of Nurses Out Loud Q&A, and we will be back next week. That is all the time that we have. But remember, we are here on the air 5 days a week, Monday through Friday at 10 a.m. Eastern. You can also catch the encore at 11 p.m. Eastern Standard Time. Please be sure to tune in and listen to myself and my amazing sister nurses who are here with me today. As we walk you through all of these hot topics, we will empower you with information and education. We will advocate and we will stand in the gap for you, because we are nurses and this is what we do. I'm your host, Nurse Kimberly Overton, and you can find me here every Wednesday morning at 10 a.m. Eastern. Until next time, be safe, be well, and God bless.
It's time